The way in which the markers can be used is actually somewhat different for the two markers, in my view. The broadest use of troponins in human heart disease patients is for those patients who are suffering from myocardial disease, primarily myocardial infarction. And because these are markers which are released from dying cardiac myocytes, they're really an indication of myocardial injury. Now, the same sort of myocardial injury, myocardial infarction, actually occurs very infrequently in veterinary patients. We recognise it in cats and occasionally in dogs. But probably the one place where I think troponins might be of the greatest use is if you are suspicious of ischemic disease or inflammatory disease of the myocardium. I actually think that the natriuretic peptides are much more valuable markers, and we know much more about them at the moment. The natriuretic peptides, because they're markers of wall stress, really tell us about changes in two things. One is they tell us about changes in filling pressures within the heart, and secondly, what they may do is give us information about changes in heart size, because effectively ventricular myocardial wall stress is determined by the size of the chamber and the pressure within it. Now, why that's particularly useful is that for the more common cardiac diseases that we see in dogs, they are characterized as the disease progresses by an increase in heart size, a retention of fluid, and an increase in cardiac filling pressures. So generally speaking, the natriuretic peptides will go up as the disease severity progresses, and particularly they're at their most elevated when animals go into heart failure. So the thing for which the assays have been most well validated is for the diagnosis of heart failure, or the discrimination between animals who are breathless due to heart disease and animals who are breathless due to respiratory disease. So I think where they are currently rightly placed in the market is that they are marketed as diagnostic tests, particularly for the diagnosis of heart disease and failure. So that's really where their current use resides.